Hello everyone. In this video I will be discussing about direct anterior hip replacement surgery. Direct means direct, anterior means from front, hip replacement is hip joint replacement surgery. This is how this is how bones are seen if person is lying down, and this is hip joint. This is a ball of the femur. This is socket. If we are seeing from the front, like if I am operating like this and I am seeing directly from the front and operating from the front, this is called direct anterior hip replacement surgery. Meaning, patient lying on the operation theatre supine, the hip joint is lying like this. Operating surgeon is seeing the hip joint from the front. If I am seeing the hip joint from the front, operating from the front, surgery is done from the front, it is called direct anterior hip replacement surgery. How it is different from the traditional hip replacement? Traditional hip replacement is from the back. Surgery is done from the back on the buttocks, and the implantation done from the back, and position of the surgery from the sideways. The advantage is that since the surgery is from front and it is between the muscles, when we go between the muscles without cutting the muscles, the bleeding is less, recovery is little faster, and the dislocation rate means the chances of ball and socket means this ball coming out of the socket is less. The chances, which is slightly high if implant position is not very accurate in posterior approach, means conventional or traditional hip replacement. What are the things which makes this not very popular? One is it is a steep learning curve, means surgeon has to go through a specific training and then has to do it, and not all patients are suitable for this procedure, because hip replacement is done for different variety of reasons. Some particular causes of hip replacement are not suitable for this type of approach, and if there is any complications of hip replacement like some fractures or someone coming after hip replacement with fracture of the femur, thigh bone, or fracture of the acetabulum or some other complications, this approach is not so suitable to go through second time. Meaning, if there is any problem, again the approach will be from the posterior, not from the front. This makes it not so much desired for many surgeons. One is that it cannot be done for all patients. It is not versatile, in meaning if there is any problem in future, we cannot go from the front, we will have to go from the posterior aspect. And whatever said advantages are not very much different in proportionately from the conventional or traditional posterior hip replacement. And the key thing is positioning or implantation angle of the implants. This is very crucial for the results of the patient. It's not the approach. Question which is commonly asked from the patient is, how many years my hip is going to last? If I say that it will last 30 years or 35 years, this longevity is dependent, or which is the function of the position of the implant. The longevity is a function of the position of the implants, meaning the position of these implants, the angle of these implants, and the bone grows, and how this bone integrates on these implants doesn't depend on whether we do from the front, whether we do from the back, or whether surgery is done from the side. It doesn't matter whichever approach your surgeon chooses, but the implantation has to be accurate, and you can be pain-free with this procedure. To conclude, I can say both the approaches have comparable results if implantation is done in accurate manner, which is based on the experience of a surgeon, and if implantation is done in accurate manner, the outcome of the surgery is excellent in both the approaches. As you all know that hip replacement is one of the successful surgeries of this century. Then friends, if you have liked this video, if you think this information is going to help you or if this has benefited you in some ways or for your friends or family members, then please like this video and share with your friends, and don't forget to subscribe to my channel. Thank you very much for watching.